Today we all are here for the COVID awareness webinar, which is being presented to you through Aster volunteers along with Aster Social Club. We have our doctors who have joined us on this panel, and they would be talking about COVID-19, which is a worldwide pandemic. So we have on our panel today with us our community doctors, Dr. Mazuddin Muhammad, who's our general practitioner at Aster Volunteers Mobile Medical Services. And we have with us Dr. Satish, who's our general practitioner also at the Aster Volunteers Mobile Medical Services. We also have with us Ms. Jinsi, who is from Al-Khail Gate community and also working along with the Akma Social Club. Jinsi will talk to us about how the webinar is getting associated with the community.
നമസ്കാരം. നമ്മളിപ്പോൾ ഒരു പാൻഡമിക് ഫേസ് ചെയ്യാണ് COVID-19 വൈറസ് കൊണ്ടുള്ളത്. ഇപ്പോൾ എല്ലാ കൺട്രീസ് അലോങ് വിത്ത് ദെയർ ഗവൺമെന്റ് വി ആർ ട്രൈങ് ടു ഫൈറ്റ് ദിസ് ഡിസീസ്. അപ്പം UAEയിലുള്ള ഏറ്റവും വലിയ മലയാളി കൂട്ടായ്മയായ അഗ്മയും ഇതിലെ ഒരു പാർട്ട് ആവുകയാണ്. ഇപ്പൊ നമ്മളുടെ അസോസിയേറ്റ് ആയിട്ടുള്ള ഹെൽത്ത് കെയർ പാർട്ട്ണറായ ആസ്റ്ററിന്റെ കൂടെ നമ്മൾ ഇതിനൊരു അവയർനെസ് സെഷൻ കൊടുക്കുകയാണ് നമ്മളുടെ അഗ്മ മെമ്പേഴ്സിന് വേണ്ടിയിട്ട്. ഇപ്പോൾ എല്ലാവരും അവരവരുടെ വീട്ടിലിരുന്ന് കുടുംബാംഗങ്ങളോടൊപ്പം ഒരു വെബിനാറിൽ ഇവിടുത്തെ എഫിഷ്യന്റ് ആയിട്ടുള്ള ആസ്റ്ററിലെ ഡോക്ടേഴ്സ് ആയിട്ട് ഈ പ്രോഗ്രാമിൽ പങ്കെടുക്കുകയാണ്. അപ്പൊ അവർ നമ്മൾക്ക് ഇതിനെ പറ്റി ഈ സിറ്റുവേഷനെ പറ്റിയും എങ്ങനെ പ്രതിരോധിക്കാം എന്നുള്ളതിനെ പറ്റിയിട്ടെല്ലാം ഒരു അവബോധം നമുക്ക് തരുന്നതാണ്. അപ്പോൾ എല്ലാവരെയും ഞാൻ ഈ സംരംഭത്തിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. with the AGMA members name and all the efficient panel of doctors name. Thank you.
Thank you so much, Jinsi. So we also have along with us our specialist doctors joining from Al-Khail Mall Clinic. We have Dr. Asta Mishra, who's our specialist obstetrician and gynecologist. We also have with us Dr. Sunita George, who's also our specialist obstetrician and gynecologist. Dr. Samit Alva, who's a specialist pediatrician, he would also be talking to us on COVID-19 and pediatric related conditions. We have two more doctors from our Aster hospitals joining us on this webinar. We have Dr. Sunil Vyas, who's our specialist pulmonologist at Aster Hospital Alcaces, and Dr. Manoj Sharma, who's an emergency trauma physician at Aster Hospital Alcaces. So welcome everyone, and with this we start a small discussion on COVID-19. So Dr. Satish would take us through this. So Dr. Satish, if you can just brief us on the pandemic which is going on.
Yeah. Good afternoon. Hi, I'm Dr. Satish. I work for Aster Mobile Clinic. I'm a general practitioner. If you see many areas in even nearby localities also, many of you know by this time you saw a big bus, Aster Mobile Clinic. We screen lifestyle, hypertension, blood pressures, blood sugars, we screen inside, and there is a free consultation of doctors. Both doctors are from Aster Mobile Clinic. And now, recent months, everyone knows that COVID-19, we are bothered about this COVID-19, which is also called as coronavirus. And while we go to communities, many are worried about this virus and the spread in social media. Even if you see now also in WhatsApp and Facebook, so you are getting a lot of information regarding this. Some myths are going around, and we closely work with Dubai Health Authority also. We have some guidelines which we have to follow. We should never spread rumors like that. Someone says like eating a garlic can kill corona. Someone says smoking killing corona. Someone says alcohol kills corona. Someone says if you take a hot water bath, you can kill corona. It's not like that. So, according to history, if you see previously, coronavirus stands second in causing all these flu-like symptoms, like cough, cold, and all. That time it was so mild and self-limiting. In 2002, February, I think so, according to some book histories I read, they know this. Some flu-like symptoms has come in a hotel where one doctor also is there, and the people who got these symptoms like mild fever, cough, cold, sore throat, and some throat pain, and all. They give like general care they have taken, but it's not subsiding. And in 2003 again, they found some typical pneumonia-like symptoms, which is almost giving difficulty in breathing, and pneumonia-like symptoms are coming. And that time, the Dr. Carlo, who checked this, and he found something different, and he took all the samples from throat, blood, and stool, and is sent to laboratories. Then they found a crown-like, king's crown-like with spikes. It looks like a crown. And in Latin, the crown they call corona. Then they named it as coronavirus. And this coronavirus in 2003, they named it as SARS corona. SARS corona, severe acute respiratory distress syndrome. And that time, even the mortality rate, means the death ratio was little high. But a few days later, few months later, it has got subsided, and many of the microbiologists, they are telling like it's hidden. It's not eradicated, it's hidden. Somewhere around it's getting mutations. And again, 2012, they saw in Middle East, they named it as MERS, Middle East Respiratory Syndrome. And they found it is transferring from animals. Especially in 2003, if you see, they tell civet cat. From civet cat might be the secretions as the contact with the secretions from the cat, or might be somebody ate the cat. Something has happened and this virus has transferred. And from dormant camels, like in Middle East, the virus has transferred to others. And that time, even the situation was a little panic because the mortality rate was a little high that time. Now, we saw a typical corona type virus only, which is we tell like coronavirus, COVID-19. COVID-19, till now, if anyone says it comes from animal, it's not right. We don't know from which animal it has come. There is no clear evidence till now. But thing is, compared to previous history, we have a doubt that some animals transferred. And the point where the outbreak has occurred, if you see there the main is the livestock area, poultry area, and this fish markets are there. Now they are suspecting this might be from animals. That's it. But one thing is for sure, it is spreading from human to human, and it is very fast. And if it comes to human, the main thing we think that if you go nearby, it will come. No, it's a droplet burn. It's not airborne. If from a respiratory droplets from your nose, from your mouth, while we cough or sneeze, I'm not touching, I'm sorry. While we cough or sneeze, if secretion comes out, it land on you or any nearby areas to you. If you go and touch the same secretion, which is the droplet have virus, then it may transfer. And it won't transfer from your hand directly, as if it enters into your hand. When you touch your eyes, nose, or mouth, where there is a point of entry, then this virus may go in, or in your face, any nearby your face areas, you may inhale the virus, and this virus can cause a respiratory illness now. And this comes under, as I told you, it's a respiratory illness causing viruses. And another thing is how you know what's the medicine. There are many people telling now, some people has invented medicine, some people have shown good result if you use this medicine. Until now, there is no complete cure. There is no cure or no vaccine, not it. And some people, if there is pneumonia-like symptoms, you can take pneumonia vaccine. No. If we take pneumococcal pneumonia vaccine, it doesn't help with corona. It's entirely new virus, new strain of virus. Even in our textbooks also, the new textbooks also, we don't get this virus. We are still learning about it. From authorized websites, from authorized medical laboratories, we are getting the information. And one thing is for sure, it's spreading from human to human and through a respiratory droplet. So make sure you maintain a social distance while talking with someone. Even if you know or you don't know, or the sick person and all, if you maintain the social distance when you're talking with someone, the droplet may fall just in between you. It won't reach you. If you maintain the 3 feet distance or 1 meter or more. And another one is the point of source. I told you, if you touch the secretion and if you touch any part of your eye, nose and all. So main thing, what you have to do, don't give shake hands unnecessarily. And better don't give. Use a good way of wishing, as we all do, like salam, namaste, or bow. Just even Chinese also, they bow. They don't give shake hands. And now this is the best, and we are looking all around. Everyone is aware now. No one is giving shake hand. And if you see, we are all sitting not in a crowded things. We are maintaining that social distance now. Better to avoid. And not everyone will get a infection. Not all the cough, cold, or coronavirus. And we are still taking them as suspects. Suppose if I travel to any outbreak areas, as you know, you see in the media now, if I go there and come, if I have symptoms, then fine. Definitely I am a suspect. Or if I go there and come, now according to our law, it's clear that stay quarantined, stay isolate yourself in house for 14 days. And if you see any positive signs, any symptoms, immediately contact the nearby healthcare centers. And there are many good websites, and even government websites are there like DHA, Ministry of Health. You can check there, you get the information. You can know the numbers where to contact. That's the best use. And don't ever share any of the health awareness things if there is no doctor name or number or any legal authorized person. Don't give the information. So if I share, I know about little. Okay, doctor shared, it means it's some reasonable. Not all everyone can share, and everyone share the rumors and all. Then there will be lot many myths going on around. And another thing, one thing I told, like, maintain social distance and avoid shake hands. And best way, if you ask, like, sir, suppose if I am going in a lift, I have to touch the number button, 5th floor or 6th floor, it's a common one. If I go to any escalator, I have to touch the rails or else I'll fall down, and there will be a common source of infection. After all these things which we can't escape, there is only one answer for this. Now wash your hands properly. Wash your hands properly when you touch any of your parts, like orifices or like eye, nose or mouth. Wash your hands with soap or water. Suppose if I am here, I don't get immediate soap of water, better a alcohol based rub. Mostly near about 70% of the alcohol in the rubs, if you see. Alcohol based rub can kill the virus. Can. That's why we tell alcohol based rubs. And another thing is, while washing also, make sure you wash more than 20 seconds. And there is a procedure how to wash. Which is a very easy thing, and it takes almost near about 20 seconds. If you do that, my colleague Dr. Mazuddin will demonstrate how to hand wash it. And if you see any of the areas, if you see, lot many people are wearing a mask. Wearing a mask itself never prevent coronavirus spread. But the thing is, if you are healthy, no need to wear a mask. Suppose if I am unhealthy, if I have a cough or cold, if I sneeze or cough, if I don't cover my nose and mouth with my hand or a flexed elbow, now we are telling, with a flexed elbow you have to cover into it. If the droplet comes out, we have to avoid. If I wear a mask, if I'm not feeling well, if I wear a mask, if I sneeze or cough, it will lodge into the mask inside only. It won't go out. So that we can stop the spread. In that way, the unhealthy. And the other one is, suppose if my children or any of us is not feeling well, I am taking care, or I am taking care of a respiratory ill patient, I have to wear the mask. And if you see doctors, they're exposed to lot many things, not only COVID-19. We are worried about lot many virus, bacteria, fungus, many. That's why we have to wear the mask continuously. Not a healthy person who is going around, who is fit enough. And don't wear a mask unnecessarily. And if you're not feeling well, wear a mask, and don't go to clinics or hospitals with 4 or 5 people. Suppose if I have any respiratory illness, the person who is taking care of me, he have to wear a mask and I have to wear a mask. We both, if you go, it's fine. Or else if you go with your children, there are lot many infections going on, right? Unnecessarily, they may expose to infections. That we have to now, definitely we have to take care of it. And staying in home is the best thing now. And always try to explain the children what is going around. Don't panic them. If I see in Facebook and WhatsApp, and it leads to lot many anxiousness and lot many emotional disturbances may occur. And back home there are lot many family members involved. They also worried about the things happening. Just tell them, no need to worry at all. No need to worry at all. Even the death rate, if you see the mortality rate, it is very low. And it is because of already a pre-existing medical conditions. If you see in the history till now, many of the 60 years plus people, older people, I mean to say, are low immune status in them. Or they are taking any medicines for any chronic conditions, any kidney diseases, or any organ diseases, any organ failures already, or any pre-existing medical conditions, especially if you see diabetes and hypertension, if they are not in control and their immune levels are low. As now we are telling, like I am hearing the news from the authorized websites, that it's a self-limiting if your immune levels are very good. If your immune levels are low, there might be lead to a serious illness, which I told, like any pneumonia-like symptoms, if you see.
Mazuddin, can you demonstrate for us, what is the best way to perform a hand hygiene? Because to limit the spread of this virus, it is said that, you should be doing hand washing and you should be performing, taking a sanitizer, you should be performing hand washing. So can you help us, understand?
Not just hand sanitizer, the procedure is same for everything. Even if you are washing with soap and water, it is the same. Even if you are using hand sanitizer, it is same. The procedure remains same, whatever is the choice of material you are using. Basically, if you don't have any sanitizer nearby, you can go and use soap and water. If you have sanitizer nearby, you can use sanitizer anytime. While I'm demonstrating, I would like everyone out there to practice along with me. You can follow me so that you can get used to it. And the whole procedure should take at least 20 seconds. If you are doing it properly, it will definitely take more than 20 seconds. So that is the routine procedure which we do before we touch the patients, routine in our hospitals and clinics. What you have to do is first wet your hands, okay, take soap and try to rub and make foam, okay. Then you can rub the front of the palm like this, okay, then followed by the back, okay, on both the hands. This should be followed by rubbing your fingers, interlocking the fingers and rubbing in between the fingers, back as well as front on both the hands. Okay, this should be followed by interlocking your fingers and rotating this way for both the sides, like this on the right side and the left side, doing simultaneously this way and this way. This should be followed by rubbing your fingertips over the palm, both the hands, this way. And after doing that, there is only one part left, that is the thumb. Then you have to rotate the thumb this way so that you clean every part of your hand. Let me demonstrate it one more time. Take soap, palm, both the sides, back, in between the fingers, interlocking and rotating, both the sides, followed by tip of the fingers over the palm, both the sides, then here, both the thumbs. So doing this, it will take at least 20 seconds. If you do it properly, this will be sufficient for you. Any soap-based solution or any alcohol-based hand rub. And after doing that, suppose if you are using soap, then you have to wash your hands. Then take a clean towel or take a clean tissue, wipe your hands, and with the same towel or same tissue, you need to turn off the knob. Or if you don't have any access to tissue over there, just turn your the tap with your elbow, so that you don't have to again touch the tap. Yeah.
Yes. So, Dr. Mazuddin, if you can also let us know what is the best way to use a mask and in what conditions. Dr. Satish has already explained us. So if a person needs to use a mask, what should be the best way and how they should be putting it?
Yeah, there are a lot of myths also going around for using mask.
Yes.
And all I have seen on social media.
Yes.
People telling that no, if you are using mask, the lighter side should be towards us when you have disease.
Right.
And if someone else is having disease, it should be the other way around. These
Yes.
are all myths.
So there's a lot
no,
of confusion which has already been
that's what
created.
I'll
Yeah.
show that. A lot of people know.
Yes.
First thing is you need to mask only the sides, only the strings. You should never touch this front area or back area. It should be only the strings like this. Okay. And as you can see, there are two colors. One, the outer one is the dark, and this one is little lighter. So the lighter one should be on our side because there is a filter in this. And once you see there is this strip of line here, no, this is a metallic or fiber strip here. So what you have to do is it should be facing upwards, and the lighter part should be inwards. So you have to stretch the strings, put it over mouth, and touch it. That's it. Then you have to touch the tip part so that when you pinch it, it will adjust our nose. Then take this part down and pull it. Finish. I never touch this area. So you have to avoid all this unnecessary contact. And I have seen many people, and when removing also, you have to remove this way. And you have to close it and discard in a closed dustbin. And since we go to all community areas with normal blue collar workers and all, what they do is, once they remove this, after every 2-3 hours, they'll keep it in their pocket. Again, after some time, they'll start using that which we have to avoid. This single time use, and we have to discard that. Apart from that, there is no need of any N95 mask.
Exactly.
That should be used only by healthcare providers. Only normal surgical mask will do for normal common people.
So Dr. Mazuddin, because the mask and disinfectants, people have started hoarding it, and worldwide there's a shortage of it. There's a lot of panic about, procuring masks, procuring disinfectants, and governments have put this under essential commodity also now. So as I understand, we need not wear a mask on daily basis. Mask, when it is used, it should be only a single use. Wear it only when you are ill or you are caring for an ill patient. So an N95 mask is not to be used as a regular mask for protection.
Yes, I like to add.
Yes, Dr. Satish.
Yes, and the one, see, before touching a mask, make sure you wash your hands, and after discard also you have to wash your hands with soap and water. And coming to other things other than this mask, I mean to say, don't touch animals unnecessarily, or don't touch pets. If you go to any markets like a seafood or any fish market or any livestock or poultry, don't touch the meat or anything unnecessarily. Don't touch the fish with your bare hands. Wear a glove and touch. And once you take the meat and come back to home, just wash your hands properly as Dr. Mas showed now. And after that, while cooking also, you have to maintain a safety food measures. Like while cooking, make sure when you're touching any meat and while you're keeping in your vessels and all, after that don't try to taste when you marinate and all, because raw meat made many things now. So better avoid unboiled or uncooked or not properly cooked food and all. Cook properly, thoroughly, then taste it. That's the best thing. And while touching the utensils, also make sure you wash your hands properly and use it. As previous history says that this virus we saw in feces like stool and in secretions, so better you keep your toilets clean. You keep your toilets clean. There are lot many alcohol-based disinfectants. You can use that in your regular floor cleaning and all, toilet cleaners and all. And if you go to market, make sure if there are crowded places, avoid crowded places at this moment better. And if you feel any fever or anything, any respiratory illness in home, if you are isolated, if you are self-isolated, feel responsible that I should not spread. If you are isolated, if you sit in a room, make sure you use your own utensils. Better don't share these utensils with others, and use separate toilet for you. Better no other your children or any family members use that, and you clean the toilets thoroughly with, make sure the toilets will be cleaner. And if you maintain this mainly we want to tell that if personal hygiene is maintained properly, if you maintain proper food habits, if you are fit enough, if you do exercise, if you eat good fruits, vegetables, at least weekly 5 days, and 2 days you can go for a non-vegetarian diet, which increases immunity. If you sleep properly near about 6 hours, your stress levels will come down. And if you do exercise, your stress levels will come down. If you have high stress, your immune levels go down because of the steroid release from the kidney, the glucocorticoids, whatever we tell. So maintenance of immunity is main now. So be fit, do exercise, and maintain proper food habits, and be aware. And definitely you can check an authorized website to know the latest information, not the rumors, and don't spread the rumors. And thank you.
Yeah. Thank you, Dr. Satish, for this information. Now, we would like Dr. Aster Mishra, who's with us, to speak about specific points on related to pregnant females. You know, how is it? Some special precautions that they need to take. How is this disease impacting pregnant females, younger women? What special precautions they need to take?
Good afternoon, everyone. I'm Dr. Asta. I'm the specialist with Aster Clinics. And thank you, Dr. Satish, for giving us such a good information about the hand wash techniques and all, and to avoid the panic which is going around everywhere. So I'll be talking mostly about the patients who are pregnant, and actually there's a lot of myths going around everywhere that during pregnancy the virus is going to affect the baby and various things like that. I just want to assure everybody, because till now, whatever the studies have come, and there is no as such which is telling that if the mother is infected, the baby will also be infected. Though there are very less studies still around because it's a very new virus, but till now from the UK, US, and even the China where we have done, so none of the babies who were born with the mother is affected. Other than the babies who were born and who were kept outside, they might have got the infection from outside, but not through mother. And the normal for the pregnant woman, the same thing applies as for the general people. The hand hygiene is very, very important. And with whoever the ladies who are working, and they can actually keep on going for the work, there's no issue with that. If they maintain the proper hygiene, what is told to them, that keeping the safe distance and using the hand sanitizers. What I will advise is that avoid going unnecessary to the malls and to the crowded places, which is actually it is going to prevent all of us, especially the pregnant women. About the appointments for the pregnancies, for them, if they are feeling very fine and if they just were very much scared to come to the clinic, it's okay to postpone for a week or something like that, but there's no fear if you come to the OPDs and you come with a proper appointment, so that you don't overcrowd the places where you are sitting, and don't accompany your children who are actually healthy to come and see us. If you are pregnant, just come alone, or you can accompany your husband, and just come with a proper appointment unless until you have emergencies. If you get sick, with the fever and the cough, so still the COVID is there, but there are a lot of other infections which are running around, so like the common flu and things like that. So don't think that if you got a fever, so you have definitely got a COVID. It's nothing like that. You can very well come to see the general practitioners in all the clinics, and they will guide you further. as such, there is no medication for the cure for the COVID, but there is none anywhere reported mortality also, like the death of the pregnant woman because of the COVID till date. So it is nothing too much to get panic about. You can very well come for your normal checkups, come with a proper appointment, and we can still help you maintain the normal hygiene and your water intake, your hydration is very important. You can go for the normal checkups and all. Only few guidelines have come recently that they are telling that if the mother is anywhere feel to be sick or like any kind of sickness, and if we are going for the elective cesareans, like the planned cesareans, planned deliveries, they can postpone till the mother is totally well. And that is the only thing we need to do, but otherwise there's nothing major for that. And even about the breastfeeding, they are telling that if you are fine and if you don't have illness at all, it's okay to breastfeed the baby also. Only thing is that the safety has to be maintained with the newborn babies also, like you have to cover yourself and you have to wash your hands frequently. The nipples and everything has to be washed before the breastfeeding. But there's nothing to be panic and there's no side effect for the till date because of the virus for the unborn child we have reported. So be safe and just follow the normal hygiene what the doctors have told, frequent hand washing, even you can go for the work. Just only we say is to avoid the crowded places and come to the OPDs with a proper appointment. Don't come walking if you don't have any problem. If you have problem, of course you can go to any of our hospitals. So I'll just forward it to Dr. Sunita if she wants to add something on that.
I think Dr. Asta and Dr. Satish have covered up basic that is required. Same thing, maintain your hygiene, and if it is emergency, try to come. Otherwise, take an appointment. Prior appointment has to be taken. I think everything has been covered.
Thank you so much for this information, Dr. Sunita and Dr. Asta. Dr. Samit, would you like to add something, some points specific for pediatric patients, for children? How do we need to take care of them? What special precautions should be taken for children?
Hello, I'm myself, Dr. Samit Arwa. I work in Aster Clinic, Khail Mall, and also Muti. Well, I think most of the topics have been covered by Dr. Sunita and Dr. Satish. Let me add a few points when it comes to children, especially. Children, one thing is keeping the surroundings clean is very important. So most of the guidelines they specify cleaning once in a day at least places commonly children access, like doorknobs or the table things and the table ends and things like that with any of the disinfectant that is available. And also, most of them have maids or nannies at home. I think you need to ask them if they are sick or there any history of travel or someone who's come staying with them who's had a history of travel. So these are the few precautions you need to take. And also, one more thing is I think the vaccinations have to be up to date, and always make sure you take an appointment and then visit the clinic so that you don't go to a place when there is crowd and unnecessary crowding in clinic has to be avoided. And other than that, of course, the children generally tend to be scared with all this TV, media, and discussions at home. So I think little care has to be taken where you have to explain to them what it is, and rather than talking about deaths and casualties in front of children. Some children they do get affected by this. They have complaints of bedwetting and nightmares and all that. So discussing in front of children about deaths, it might not be a good idea, but you need to explain to them what it is, what is happening, and what are the precautions you are taking and things like that. I think when it comes to children, probably these precautions you need to take. Vaccination is one important thing, and avoid overcrowding, and visit to hospitals only if you really the child is sick or after taking appointment that has to be done.
Very true. Thank you so much, Doctor, for this information again. So now we would like to speak to Dr. Sunil Vyas, who's our specialist pulmonologist at Aster Hospital, Kisses. Before we start talking to Dr. Sunil Vyas, I would like to tell the audience that we do have a question answer session after this. So in case if you have any questions, you can type it in the box which is being provided. It's there through the link. You can type in your questions. So our doctors would be there to answer all those queries. So over to Dr. Sunil Vyas. Dr. Sunil, we would like to hear from you. What special precautions should the elderly people take, especially those who are suffering from chronic diseases, how they should be taking the precaution, and what advice do you have for patients who are suspected with COVID-19?
A very good afternoon to all of you. A wonderful explanation by Dr. Satish. He started in the beginning, so he covered almost each and everything. So very good. Regarding the elderly population above 60 years of age, as he mentioned clearly, that the personal hygiene has to be taken care. If they have any chronic diseases, they have to be taken care of that properly so that they do not have any issues with their immunity. So if there is something like uncontrolled diabetes or uncontrolled blood pressure or any other disease, they need to have a proper checkup and proper treatment for that. So that should be, if that is well controlled, probably it won't affect the immunity, and then probably the virus may not be affecting them as it would affect any other person who is immunosuppressed. So that has to be taken care of. Personal hygiene, as Dr. Satish has mentioned, is universal for children, for elderly, for everybody else. So, and considering the other thing which I wanted to stress is that a lot of patients are coming to the OPD who have the symptoms only of cough, dry cough, or 4 or 5 patients every day in my OPD come and ask me, do you think, doctor, do I have this disease? So that panic, I think so, should go because just having cough that does not mean that they have a corona infection or a COVID-19 infection or even a flu infection. They need to understand the specific symptoms. So as the gynecologist also, as well as the pediatrician also explained, that unnecessarily hospital visits just because they want to clear their doubts is not a good idea, because coming to the hospital itself, they can get infection, and getting overcrowding again will become an issue. So if they have real symptoms, they should definitely come. As for the elderly, as I mentioned, treating the other diseases very well and keeping the immunity is the best thing to do. So coming to suspected patients who have fever, who have body pain, throat pain, who have history of travel, who have exposed or come in contact with anybody who is suspected, probably they should definitely present to us. We will be admitting them, quarantining them, and we will do necessary steps for sampling them, and then we'll proceed further based on the results.
Thank you so much for this information, Dr. Sunil. Dr. Manoj, can you help us know, like in case if a patient is coming to the emergency, what process is being done for the patients, and how are you guiding the patients for the treatment?
Okay, good afternoon everyone. I am Dr. Manoj from the Emergency Aster Hospital, Algocais. So regarding emergency, in the current scenario, there is so much of panic, first of all, among all the people. If a person sneezes, he thinks I'm having corona, I have to go to the hospital, get it checked. One sneeze, they rush to the emergency, and the person who is coming, he is not coming only with one person, he has 4 or 5 other bystanders along with him, and everyone is saying, doctor, please see him. We feel he is having corona. Yesterday I was having cold, so I also want to get checked whether I am having corona. So this is a day-to-day scenario nowadays in the emergency what we are facing. And every time we have to counsel them and comfort them that every cold, cough or sneezing and fever is not corona. You have to know exactly what is corona, which Dr. Satish has already very well explained. So I need not go further into that kind of discussion. So in emergency, usually what is the scenario is we take a proper history. That is very important in patients who are suspecting whether they have corona, in which as per the clear guidelines of the WHO and the Dubai Health Authority and the Ministry of Health, any person who is having the symptoms, the flu symptoms like fever, cough, cold, myalgia, headache, along with these symptoms, if he or she has a history of travel to any of the endemic areas or the area where the recent case rise has been more, then we can take that case as a suspected case. Or if that person has been in connection with a patient who is being suspected or is being treated for corona, then only we need to suspect for corona. Otherwise, each and every cough and cold is not corona. Once we are suspecting a patient as corona, the next thing is we have to isolate that patient completely. No one should be around. In today's scenario, what is happening? The patients, attenders are coming, they are flushing in along with the patient, and they are not allowing even us in the emergency to maintain a proper isolation for the patients, even if we are suspecting corona. So that's a big challenge in these days. It's mainly because of the panic that has been created through all different sources of information like WhatsApp, Facebook. Nowadays, everyone is their own university. They are running in WhatsApp and Facebook with all types of newses regarding to all diseases. So it's like every day when you go through morning WhatsApp messages in so many groups, or if you open your Facebook, you will be seeing everyone has become a doctor these days. They come up with different treatments for corona and so many things. They have solutions that corona is treatable. Every other day you can find that somebody has found out a cure for the corona. So what I would request to the public is don't go by any of these false notions. Only if you have the proper WHO according to the guidelines and DHA guidelines, any history of recent travel, or if any suspected case you have been in contact with, then only come for the checkup for the corona. Otherwise, you don't have to panic. It's most of the cases the corona infection is like a mild infection only, which usually subsides in a prodrome maybe around 7 to 10 days. It gradually subsides. The infection is cleared off. So you don't have to panic. Like already said by Dr. Satish and my senior Dr. Sunil Vyas, that only in patients who are immunocompromised or who are vulnerable, whose immunity is weak, there is a chance that complications can happen. In that also, 1 in 6 patients only develop complications. That too in immunocompromised, not in any normal person who is well immunocompetent. There is no chance, very rare chances that he might land up in some kind of complications because of the corona. First of all, the public has to be well aware that they need not worry, they need not create a panic, and don't unnecessarily rush to the emergency departments of the hospital. If you keep on rushing like that, even if you don't have, there is a possibility somebody might be sitting there with suspected and you may get the infection. So only and if necessary, go to the hospitals necessarily. Thank you.
Yeah, thank you so much, Dr. Manoj, for this information. We have some questions which have come in, so we would request your support to answer these. We have a question asked by Mr. Sandeep. How can we distinguish COVID symptoms from allergic symptoms? May I request Dr. Sunil to help answer this question?
See, allergy is a non-infectious thing. Allergy generally happens because of dust, which is the commonest thing. It can happen to various other common allergens like dust, pollen, smoke, smell, a lot of other things. But it is a non-infectious thing. So in allergy, you won't have fever, you won't have body pain. You will just have sneezing, you can have running nose, you can have nasal congestion. But having fever with body pain, headache, sore throat are a common feature of infection. So that is the basic difference between allergy and a corona. Allergy will have will not have any infection. So you won't have fever, you won't have sore throat, you won't have body pain.
The explanation, Doctor. We have one more question which has come in from Mr. Sunil. Mr. Sunil would like to know what are the best ways or medium to disinfect daily used clothes, etc. after routine use? Is the normal detergent good enough, or we need to use with any antiseptic lotions or bleaches with cleaning medium? May I request Dr. Satish to
use normal washing powder like a washing, but only when you keep your clothes in a laundry basket, don't shake or just don't use force to take this thing, because not only this virus, any other viruses, any other infection. We go out, we wear we come with lot of dust and lot of bacteria, virus surrounding us. It may be on our clothes. If you just forcefully, if you try to move the clothes and all, the virus may spread in your surrounding areas. What they tell from the WHO, what I read is just take out from the laundry basket, go wash your clothes in a washing machine or with your regular detergent only. There is no such disinfectant necessary for this.
Yeah. So thank you so much. Yes, Jinsik, would you like to brief the audience on anything specific which you would like to talk about related to this awareness session?
First, I would like to really thank all the Aster team, their technical team, and the professional team for giving this wonderful session for our members. As you said, the thing is like we need awareness. It's not the panic or fear what we need. We need proper awareness about the situation, and as a global citizen, we have to follow some guidelines or some routines like the social distancing and personal hygiene too, because this has WHO has declared this as a pandemic. So we have a responsibility towards our society not to spread the disease and also not to spread any rumors so that others get panicked and they get into trouble. So this was a very informative session, and I really thank on behalf of ACMA and ACMA members and myself to all the professional team and technical team of Aster volunteers to give us this opportunity to know more about the situation and how we can go ahead and fight the situation. Thank you very much.
So we have a question coming in from Mr. Anu. What are the precautions to be taken care for kids with asthma? Yes, we would like our pediatrician to speak on this. What are the precautions to be taken care for kids with asthma?
So children with asthma, basically all their vaccinations have to be up to date, and strict indoor the AC filters have to be cleaned, and pets have to be taken care of, and also any flowering plants and all those things, general precautions need to be taken. Because an asthma exacerbation, usually the child will be on certain medications that can have an effect on his immune system, so thereby in case there is surrounding any cases of COVID, he has to be careful. And other than that, the regular asthma precautions, what he needs to be taken, has to be carried on. Other than that, I think some children might be on steroids, on long-term steroids, like for example, nephrotic syndrome children. So these children also have to be taken care. Because sometimes if they can be on more than 2 or 3 months of steroids, so there will be some kind of an immune suppression. So all these precautions need to be taken.
There's a common question when we go to communities. Sir, tomorrow I need to travel. There's international travel. Can I travel? So what we have to tell, like, avoid unnecessary travel. It's not so emergency. It's not necessary. Suppose someone gives me a holiday package, it doesn't mean if we go. Better now, because there are a lot means pandemic. When the term comes pan, it is total.
Right.
That's what they add pandemic. Pandemic. So be aware. Don't travel unnecessarily. Don't have unnecessary contacts. Don't have close contacts. While traveling also, if you travel with a COVID-19 positive person, it doesn't mean that you get COVID-19. But if you are beyond the range, like in the range of that, or if you touch the infected part, and if you touch your face or something, it may. And some guidelines, it says that if you spend time till 15 minutes with the person, or any 2 meters below circle, if you are there may be a chance that you may be a COVID-19 positive. There may be a chance. It's not the 100%.
Yeah. But still, we do not have any specific studies which indicate that you have acquired. So research is still on this. So it's
very low evidence.
Yeah, right.
Still, a lot of research have to be done, and already we have to appreciate the doctors sitting in clinics and hospitals. Really, you are doing the awesome job there, and definitely it's like a war. We tell that it's like a war. And another thing is, whatever research comes, we are ready to give the latest information. Go with the authorized websites. Please don't spread. And while you are traveling, you can wear a mask and don't touch others unnecessarily. And while you're traveling, better don't eat food outside. Better eat yourself and drink at least 3 liters of water per day from morning to night. Wherever you reach, there will be a thermal scanners. Thermal scanners doesn't screen COVID-19. Thermal scanners can screen your body temperature. If it is right, it means that there is a reaction. Some defense fight is going on inside. Because of that, there is a raising temperature. Then they will isolate you. They will check for COVID-19 and take all the history, and they will take care of you. Okay. So if thermal scanners are there, better go check yourself so that you'll be, if anything comes positive, they will take care properly. Now everywhere they are quarantined for 14 days. It's best because we want to break the chain. That's our main goal. This from a spread from human to human. To stop it, maintain the social distance. Be aware. Go to the doctor if necessary, or don't go to clinics unnecessarily. These things if you can maintain.
Yes.
I would like to add one more point. This is basically for the younger generation people. They might feel that they are going out roaming and all, not taking necessary precautions and all, roaming around with friends and all. They might be acquiring that. They might be acquiring that COVID-19 and all. Because they have good immunity levels, they might be asymptomatic, they might not be showing those symptoms. But when they get back to the home and all, they might transmit that to the parents, grandparents and all, who might have low immune system levels. So I suggest I encourage all the youngsters to keep social distance, to maintain social distance, not to go out unnecessarily. Only if there is necessity, you can venture out. Otherwise, try to stay home, maintain that quarantine levels.
Yeah. Yes. Thank you so much for this information. So we have one more question coming on from Salish and Nayana. Is it advisable to take medicines to boost immunity apart from vitamin medicines? So again, I would request Dr. Vyas if he can add in some expert comments on this.
I don't think so. Medicines will make a drastic difference in boosting the immunity. If you are staying healthy, as Dr. Satish said, drinking, sleeping properly, having less stress, eating healthy food, everything, then your immunity itself is going to be very good. I don't think so any medicine is required at this moment of time to boost immunity, and it will help in preventing any flu or coronavirus infection.
With this, we would like to conclude our webinar. Thank you so much for joining us, and we hope that all of us would be there together in breaking the chain, breaking the transmission of this disease, and we all can do it together by following the universal precautions of hand washing, keeping social distancing, and taking due care of ourselves. Thank you so much.